Today, Dr. Professor Surani, GRRSP faculty and mentor, is giving our initial talk about research and publication, why we should do it. Professor Surani, all yours.
First of all, thank you all for having me over here. The key thing is that, you all don't have to be shy. One thing you realize, whatever stage in your career you are, we have been there. So it is nothing new. The second thing is most of us are foreign graduates. So there is nothing shy about it. Yes, yeah, we have been in this country for decades and we have been to Ivy Leagues and we have served in a lot of different capacities, including serving in the board for CHEST for years and years. So I think, everything is possible. I think you've taken the first step, making you different from the rest of your colleagues. The competition is tough. We all know that. We don't have to tell you. One of the key thing is that all the folks, who are trying to get residencies or some of the goals in their career, there are 100,000 people who are applying for the same position. How you differentiate yourself that you can cross that bridge and you can be shining among the herds. So I think, I'll try to go in there. Slides are not fancy. There is nothing there. There's a lot of didactic, a lot of the things I can talk, but my goal over here is to make the thing very simple, more practical. I've worked with the world-renowned researchers in the major papers, and I work in the most minor papers. The paper quality can range from very low to very high. Why we do that and what we should do, what should be our goal? And I think we'll try to go into that. First of all, we'll go into why we should do the research. Why just not do anything else? And why it should be published? So let's go into the goals. Why, what, and how? It's very simple. And I think, the main thing is that why we want to do that. So let me give you some of the reason. For example, I think, a lot of the foreign graduates, when they apply, or even the American graduates, when they apply, the competition is tough. So how would you differentiate yourself from rest of the crew? Most of the people who are looking at it, they're looking at the global view. They want to see that how the holistically you can do that. One thing is to get the entry into the door. The score is the key thing. If you don't get a good USMLE score, you're in challenging position. If your gap between the time when you graduated and the time when you're applying, that's a challenging. Then the third thing is if your visa status is not there, that becomes a challenge. So a lot of the time we encounter a lot of folks like, when I came in, I was on a visa. I was not a citizen or a permanent resident or anything like that. How do you do that? What thing you can use as a trampoline to get to a point where you want to make an impact? How can you differentiate your application from anyone else? Number one, number two, number three is your scores in the USMLE. You have to have that because that's an entry point. If you have a perfect score, then do you need a trampoline to get research and publication and get somewhere else? Yes, still you may need it. For example, if your score is excellent and everything, you can get into a program, but then your goal can be that, why don't I get into Harvard or Yale or Stanford? And there are some people like me who Yale offered the position and I turned it down in the residency. So, and they were shocked that why they send a 4-page letter, why I turned down the residency program. But then obviously we always have our reasons for that. So if your goal is that if you have graduated or you're graduating, how you can make your CV looks different than rest of the other. So the research, something can be in there. Second thing is the passion. Some folks are really passionate about it. They may have some incident in their life or during the program, they got mentored by someone and they're very passionate. They just love it and they want to do it. Even if they have a perfect score, they can get into a very good program, but that's their passion. And some of the folks who just want to love one specific topic. I can tell one of my co-colleague when we started, he just wanted to do with the asthma and COPD. All his life, he did nothing except asthma. He never published anything beside asthma and COPD. And his goal was self, that he wanted to be the best in the nation and in the world. And I think he is there. So all his life, 40 years or 35 years, he spent on asthma COPD. So he's one of the leader in asthma. So I think, you have to think and take a step back and reflect on yourself. What do you want to do it? What is your goal? Question is, yes, I want to be the best as my specialist, or I want to be the best in the fluid management in the world. But to be best, it can take decades. If your goal is that you want to get a residency spot and you have a 6 months time duration, 1 year, 2 year, then you can go into that. And I'll come into the publication process based on what time duration you have. So question is, again, what is your target? Whether you want to get a residency program, or if you're in a residency program, you want to get a fellowship, or if you're a faculty, then you want to become dean, or you want to become full professors. So I have a mentee who have been from the high school level all the way to the dean and chief of medicine level. I have some of the high school kids who at some point started with me in the high school, and they are now the chief of neurosurgery, and they publish 40, 50 papers a year, and they have several NIH grant. And I actually never had a primary as an R01 grant myself, because I've been in a private world. So I think it's a great sense of satisfaction that when you see those folks, I think especially the new year is a very good time, and you get a lot of email messages of what they're doing, where they are in their career. It's a very rewarding and satisfying thing. Now, the key factor is if you are going to do a research, and let's say if you're wanting to use as a trampoline to go from your medical college to some of the residency program, what time duration you have. And depending on how you build your CV, it really depends on your time duration. For example, from the time, if you want to apply for your residency application, is just 6 months versus you have a 3 year, the approaches taken can be very different. If you just have a 6 months, you know that a very good major journal, from the time you submit, even if you have the data, if you have written it out, from the time you submit, it goes to the reviewer, it comes for the revision, and it goes back, comes back, goes back, accepted, then goes to the publisher, editing, everything. It get published, it can take 3 to 4, 6 months, and sometimes longer, depending on the number of revision and depending on when they get in the PubMed. Some of the journal have an embargo that it cannot be go in a PubMed, or it cannot be doing that for 3 months, 6 months. So question is then, if you have a 6 months timeline, then you have to pick up a journal which can get it turnaround time is faster. And that's where the challenge comes in, that a lot of the fast-paced journal, they all have open access fees and things like that. But that's where you have to balance out how you can collaborate with somebody and either make the cost lower, or sometimes you do as a get an invited review and then go with that. So the time duration is key. On the other hand, if you have a 3-year time duration, when you started in the second year medical college or first year medical college, yes, you have a time. Then you can shoot for some of the journal, which the open access fees may not be there. They do take time. And again, their impact factor may be different. Then you can actually have some time. So everyone in this group or anyone can be very different. Everyone has a different goal. Someone may have a score of 260. Someone has a score of 220. Someone may be a permanent resident or a citizen. Someone may not be. If you're not a citizen or a permanent resident, you have a challenge in your hand, because the HCA Corporation, which controls almost 45 to 50% of the residency slots in US, they have formulated a law that they're not going to take anyone who is not permanent resident, or they're out of the training for more than 3 years. So I think that's something which you have to keep in mind. Then you have to look into it that, yes, you have a target, you have a time duration. What are the logistics you have? What are the experience you have? How much, if you have a lot of data and if you have analyzed, things are easier. But if you don't have the experience, you have never done it, I think the key factor is network, mentorship, and collaboration. If you can't do that, you're in trouble. And when we go into the publication side, and I'll show you why collaboration and networking is important. How to do that? And I think we touched on it a little bit. You want to know the right people. I think, again, if you have a 6 months or a 1 year duration, and you go into a lab, and that lab is a well-known lab, but you have worked 2 years and you may have not come up with one abstract. And if your scores are marginal or a borderline, how you're going to make a difference? And a lot of the small community program, they really don't carry the value if you're working in a lab. On the other hand, if you have a perfect score, which is, I don't know whether it's a 260 or 270, you all know those things better than I am. And you have a perfect score, you can get into a BRIC program and you're applying to Harvard, Stanford, Johns Hopkins, or Yale, then the question would be is that, yes, they will value the lab research and something in that area where some of the faculty may be working. I used to work in the role of the isolated neutrophil in the rat diaphragm. So I used to cut a lot of spark dwelly rats and anesthetize, and then we'll isolate the diaphragm muscle and then study the role of different immune modulators on that. But then one time the rat ran away, and that was a pretty scary thing. It took me 8 hours to find it. And after that, I said, I'm not cut out for the bench research. And then I moved to the clinical research. So you need to know the right people. The collaboration and connection is very important. I think it doesn't hurt. And I think a lot of the time, I don't know how the culture is there, but almost 3-4 decades ago, when I used to be in Pakistan, the culture was that obviously the internet was not there and the Google was not there, and people who know, they would hide from you. There is always a tendency to hide from that. I think, one of the thing is that thing, you have to go beyond that. Those things are beneath you. The more people you collaborate, the more people you join hands with it, the faster you will grow. Because, it says like, team, together we all achieve more. So if you are combining and working as a team, you all will get there. Trust me, they are not your competition. In the residency program, if you have worked with somebody, and I've established at least 3 residency program. I've founded an emergency medicine residency program, critical care fellowship, pulmonary fellowship, and I've served as a faculty for EM and FM. So I've done for almost 25 years. And one thing I can tell you, if my co-resident tells me that interview candidate is good and I know her, that trumps everything. I will go with a little lower score. I will go with a little less experience. So if you're working in and one person get a residency slot, if you haven't got it, trust me, if you're on a good terms, they're going to say a good word, and if they're a good resident there, that means a lot. And I can tell you, I have gone through the list in which, based on the application, I have seen somebody who are very high on the list and somebody who is somewhere in the middle or lower. But when I got a very good recommendation from people who I know, residents or my co-faculty or someone, and we have taken those patients. So that thing weighs a lot, because on paper you can look good, but as a program director, we want to see what and how strong you are, what type of person you are. And that, you can see from the paper, but if somebody validates that, that means a lot. Find a good mentor, and everyone needs a mentor. And I can tell you, like, I have published more than 400 papers and 50, 60 book chapters, being in a private practice. But there is always, sometimes I get stuck. I will pick up a phone, maybe once a year, and I will dial 2 people. One of them is the chief of the Scott and White whole Baylor system, and he's a dean, very good friend of mine. I'll pick and bounce the idea. So I think the mentors are not there to do the work for you, but they can give you a guidance. I'll give you a very simple example. If you come up, a lot of the time the resident comes up with a project, and then I realize the resident is in 2nd or 3rd year, and he may have a 1 or 2 month elective, and the work or project, what he's telling me, it will take 2 years, 3 years to finish it. My thing is I will advise because he will be gone and the project will collapse. So I think it's very important to bounce the thing out with the mentor because they can give you an idea what thing will work for you and what thing will not work. Because if a person coming in, they have 3 years time and they want to collect the longitudinal data for 2 years, it makes sense. But if you have a 1 year time and if you want to collect the data for 2 years and you would not be in that hospital or in the clinic or in that country, then it doesn't make sense. And you all are smart, but sometimes some people want to be very unique and out of the norm that, oh, I've done this longitudinal study, but the question is it practicable? It is doable. And do you have a time and that? Collaboration and network, I cannot enough emphasize on this topic. That is where your strength will come in. So in other words, if you have a paper in which you are working, you can work as a isolation and work on that one paper. But if you collaborate as a team, it shares the workload. Maybe you're working on that paper 80% and you're a first author, but then other paper you may be working 30% or 20% and a 40%. Now you're in 4-5 papers. You may not be first author in all 4 or 5, but on the other hand, automatically your publication list grows from 1 to 5 in the same time duration, plus your citation multiplies 5 times. And again, you have 5 more friends and collaboratives with which you can work in the future. So now coming to the point is publication. So this is important. So you decided on the research and now you're coming at the point as publication. So, people have to think about what to publish, where to publish, and how to publish. Okay. And I think my thing is very, very simple, that what to publish, how to publish, it all depends on your interest. Some people have an interest in, they want to go in cardiology. Try to find a mentor, see if there is something in the cardiology going on or GI going on. Some people are not sure. Then you see whatever is your collaborator have is, or whatever you have the availability and you do that. I think I was giving a 4 or 5 minute warning, so I'll try to cut it short, but leave the time open for question. And some people can be opportunistic, and I think look for the heart issues. And the COVID-19 has provided a lot of dynamic changes. People who are not researchers, they become researcher, and people who are researcher, they just went down. So a lot of the clinicians who were in the community hospitals and they were not publishing, and all of a sudden nobody knew anything about it. So it was an open game, and there are 5 million papers written on COVID, and everyone was publishing, trying to educate. And all of the people, when they start seeing the name on the publication, they all start publishing, and the bar was very low. I can laugh at it. When I put my vaccine paper, I look at it, and there were like 3 vaccine trial undergoing on, or 4, and it was a joke, got accepted within 2 days because there was nothing there. It was in the March of 2020 when the vaccine was just even starting that point. And as the time goes by, some of the other hard issues, like people take the opportunities that the mental health, bullying, burnout. So there are, isolated patches of hard issue coming in. Look into those. And also, when you want to publish, you also have to look into it, that how to get it done. For example, there is a asthma study done. Somebody has done the survey. How you can make it different? Well, you say it's already been published. How can you not publish? Well, then take a thing about the UAE. Was it done in UAE? No, you can take the same model, replicate in UAE. Was it done in India? Was it done in Pakistan? Was it done in Afghanistan? And that is very easy. And then you have to do is, when you get the topic, you have to find out what journals you have to do. And journals you have to do is tier 1, tier 2, tier 3. If your caliber, if you want to write a paper for JAMA or NEJM, it can take years. And if you don't have the years and the time to work on one paper for 4 years, that's not for you at this moment, not that you cannot do it. So then you have to decide whether you want to go to the chess, which will take a year work, or you want to go ahead and do something fast, but make sure that you try to get an index in PubMed, because that's a valuable, because there are now hundreds of thousands of throw-off journal which may be not indexed. So you don't want into burn into the trap that they charge you a couple of $100, but you get a name or nothing. But you're desperate, you want to get something done in 2 weeks, and you just want to have a name in the paper, yes, you can go for it. Because what will happen is that a lot of the faculties in the community hospital, they may not know the difference really between non-index, index, and PubMed. The time frame is important. Look into the open access fees and collaboration. So I think my time is out. I'm going to stop here. Back to Rahul.
Thank you so much, Dr. Surani. Really, really appreciate somebody who has been clinically trained from one of the many prestigious institutions in the country in Pakistan, as well as doing your training here from Ivy League programs, being a clinician, being a researcher, being a program director, and coming from you, it is excellent. I will stop the recording now. Please watch it and like and subscribe, but we'll open it up the forum for Q&A for next 5 minutes.